Hello again, everybody. I am Wanda Thibodeau, and this is part 2 of my series on eating disorders. In this video, I am making my recommendations for treatment based on my previous findings. So if you missed the first video, I strongly recommend that you go back and watch that one just so that you can understand why these recommendations are being made. So without further ado, basically, the types of therapy that are out there are Freudian-based therapies, and then you have what I refer to as Weisian therapy, based on a well-known therapist named Weiss. Freudian methodology basically is very past-oriented. It's based in the subconscious. Psychoanalysis and psychodynamic therapy are very much based in Freudian thought. All the other types of therapy that are out there essentially are derivatives of Freudian thought. Even cognitive behavioral therapy, which has been shown to be very effective in eating disorder treatment, has Freudian biases in it. It focuses on the belief patterns, but it doesn't necessarily avoid the biases. You might say, well, I believe X, and your therapist might say, well, I think you believe X because of your childhood. So it's very, very biased in that sense. The main differences in terms of the therapist's role also is very significant. Freudian therapy sees that the therapist must be very neutral, and so that the patient does not inadvertently get the wrong messages or things like that, have their the needs unmet or met in a negative sense. Whereas Weiss believed that the role of the therapist was to disprove all the pathogenic, what he termed pathogenic belief systems, or your negative belief systems. He viewed that the role of the therapist, above all other things, was to find out what do you believe, and then work toward the goals of the patient based on whatever you believed. So, if you believed that you were worthless, they would discover that, and they would work on why do you believe that. How is that belief formulated? How can you change it? Weissian therapy is very collaborative in that sense, and it's not necessarily path-based. You can say, well, just yesterday I went into the store and, he said something, so it made a new belief in my mind, or whatever the case may be. Whether or not the belief is past or present-based is irrelevant. It's just how did it form, and nothing is really assumed in Weissian therapy as well. So that basically means that all of the stereotypes that come along with Freudian theory essentially have to be done away with. So with Weissian therapy, what that means for eating disorder treatment is that you can't use any of the stereotypes, any of the statistics that exist on disordered eating and abuse, all that kind of things, essentially become useless because you have to investigate every belief and every individual, every case, very independently. You can't assume that just because X% of eating disordered individuals have been abused, that the individual in front of you will have been within that percentage. So that's another main difference. You have to start from scratch, and every case is independently reviewed. This begins, now that that has been set out, the differences. I strongly recommend that Weissian therapy that focuses on the belief systems and the goals of the individual is better than psychoanalysis, Freudian-based pathologies, cognitive behavioral therapies, even though cognitive behavioral therapy and Weissian therapy are both similar in that they investigate beliefs. So understanding that, my recommendations are as follows. First, if you are a therapist, encourage your patients to be true to who they are. It doesn't matter whether or not they adhere to one gender stereotype or what have you. Cultural norms, well, you should do this or that to feel better. Just be true to who you are. That is what you should advise your patients to do. Just be true to yourself, whatever that may be. Really try to investigate cultural norms and, why do you think that, this is what is normal to do. Also, instead of affirmations, which are very popular, make your patients say something like, well, I want, or I need, because that's one of the most difficult things for an eating disordered person to do, is to admit that they have needs, that they want, and that they desire. So the affirmations are good. They can pep you up, but they can kind of set you up for a fall too. You know, if what you affirm doesn't come to pass, it can really let you down and make you feel worse. So saying I want or I need and filling in the blank at the end of that, it's very self-assertive, but it doesn't necessarily set you up for that kind of fall, and I feel that it's more realistic than affirmations are, even though there is some benefit to affirmations in terms of, you know, getting pepped up. Also, there needs to be a change in the loaded phrasing of therapists. For example, to say something like, or even saying something like, well, you know, your childhood was pretty hard, wasn't it? The implication of that statement is that, well, yes, it was hard. The way that it is phrased, or even saying, well, your father wasn't there very much, or something like that, you know. Again, that invites the patient to assume what the correct answer is. So it's better to just say, well, it's pretty clear that you believe this. We've established that. Let's examine why. You know, why do you hold the belief that you do, rather than, you know, going off and delving into an examination of the past again. Also, make sure that you enlist the aid of your family and your friends as collaborators. In Weissian therapy, or the Weissian approach, again, the therapist is not neutral. They are working toward the patient's goals all the time. And so to avoid the therapist getting burnt out, you know, and being drained, use the family and friends as an advocate. You know, they can provide increased accountability. They can help the individual to feel like they have more support than just one person. So I really do recommend that, especially because the Maudsley method, the Maudsley family method, has been shown to be statistically very, very effective as compared with other approaches that are individualized. Also, don't assume that any belief that is behind disordered eating is irrational. That is one of the biggest misconceptions in disordered eating, is the fact that it's an irrational thing to do. It is very rational based on the way that the person processes their biology, their experiences. A lot of times it is just a matter of not being able to process in a way that lets us determine, hey, you know, that's not really accurate. We don't have the data that will say to us, oh, well, yeah, I know, you know, they don't think that I'm worthless, or, you know, that's the real problem. Based on our past experiences and the way that we are processing our own biology, that's the real problem. So our thoughts are rational for what we have. You know, this isn't by any means to say that it's a good thing when we are thinking these things. It's merely to say that if you approach it that we are being rational for what we have, it's more respectful, because you assume that we have some semblance of sanity left. And in terms of compulsory treatments, that's everything, because we do understand what, you know, my interviews very much show that we understand the effect that we have on our families with these disorders. We understand that we are sick, we just can't get away from it. We understand that we are at a certain point, but there's still something in our head that says you could go lower, or you could do it more often. But we still understand where we're at that point. It's just that we can't stop there. So we do have a certain understanding.